Hello, and thank you for joining. In this webinar, we will be giving you an overview of the 2024 MIPS Improvement Activities Performance category. Next slide, please. This presentation is only a general summary, but it is not a legal document. So we refer you to the relevant laws, regulations, and rulings for official details about the MIPS program. Next slide, please. In today's webinar, we will be presenting an introduction. We will be giving you an overview of the Improvement Activities Performance category to include basics, updates for 2024, participation, and reporting and scoring. We will also direct you to resources around help and support for the MIPS program. Next slide, please. Now we'll get into an introduction. So the MIPS program, this presentation reviews the participation requirements for the Improvement Activities Performance category for 2024. You can access this webinar as well as other MIPS overview webinars at qpp.cms.gov/resources/webinars. Next slide, please. In this slide, you'll see a diagram of the timeline for reporting to MIPS. So for calendar year 2024, you will report data for a performance period in the performance year between January 1st, 2024 and December 31st, 2024. In early calendar year 2025, you will submit MIPS data for the performance period in 2024. In mid to late calendar year 2025, CMS will provide feedback on your performance based on the data that you submitted. And starting on January 1st, calendar year 2026, CMS will apply a MIPS payment adjustment based on your performance on a claim-by-claim basis to your covered billed services under the physician fee schedule. Next slide, please. So the MIPS program is divided into 4 performance categories: quality, improvement activities, cost, and promoting interoperability. Your performance across the 4 categories results in a MIPS final score between 0 and 100 points. The MIPS final score you receive determines whether you get a negative, neutral, or positive MIPS payment adjustment. And a payment adjustment is based on performance during the 2024 performance year, and it will be applied to your Medicare Part B covered professional services starting on January 1st, 2026. Next slide, please. There are 3 options for reporting to MIPS. Traditional MIPS is the one you are probably most familiar with. You select quality measures as well as improvement activities from the improvement activities inventory. Clinicians are automatically evaluated and can be scored on up to 4 administrative claims quality measures. You report the complete promoting interoperability measure set. And for cost, you'll automatically be scored on all cost measures for which you meet or exceed the established case minimum. The second option for reporting to MIPS is MIPS Value Pathways, or MVPs. MVPs are essentially a meaningful grouping of measures and activities to provide a more connected assessment of the quality of care. You select the MVP to which you will report, and you select quality measures and activities that are available within that MVP. Population health measures are scored as part of the quality performance category. You report the complete promoting interoperability measure set. And again, you'll be scored on every cost measure available in the selected MVP for which you meet the case minimum. The third option for reporting to MIPS is through an APM performance pathway, or APP. This streamlined reporting option is a predefined measure set. It's only available to MIPS APM participants, and the APP is designed to reduce reporting burden and encourage participation in APMs. Next slide, please. Now we will give you an overview of the improvement activities performance category within MIPS. Next slide, please. So the improvement activities performance category assesses your participation in clinical activities that support the improvement of clinical practice, care delivery, and outcomes. The improvement activities performance category inventory contains 106 activities that are divided into 8 subcategories, which you see here. The subcategories are expanded practice access, population management, care coordination, beneficiary engagement, patient safety and practice assessment, achieving health equity, emergency response and preparedness, and behavioral and mental health. MIPS participants can choose the activities that are relevant to their practice and support the needs of their patients. MVP participants choose the activities within their selected MVPs. Next slide, please. The improvement activities performance category has certain requirements for traditional MIPS. The improvement activities performance category will be 15% of your total MIPS final score. The performance period will be a minimum of 90 continuous days between January 2024 and December 31st, 2024. And again, there are a total of 106 improvement activities from which to choose. Next slide, please. The inventory is divided into 2 types of improvement activities with 2 different types of weighting, either medium weighted, which would be worth 10 points, and high weighted, which would be worth 20 points. Small practices, non-patient facing clinicians or clinicians located in rural health professional shortage areas, or HPSAs, receive 2 times the number of points for each activity in traditional MIPS. These clinicians report no more than 2 activities to receive the highest score. In order to achieve credit for an improvement activity, you need to select the activity, attest yes to implementing it. And the maximum score of points you can receive for the improvement activities performance category is 40 points. Next slide, please. So for 2024, we did make some changes to the inventory. We added 5 new activities. We made changes to 1 previously adopted improvement activity, and we removed 3 activities. One of the activities that we added is entitled Practice-Wide Quality Improvement in MIPS Value Pathways. And this activity allows clinicians that are reporting an MVP to receive credit for adopting a formal model of quality improvement related to a minimum of 3 of the measures reported as part of the specific MVP. 2 of the activities that we've added are in the population management subcategory, and they're entitled Improving Practice Capacity for HIV Prevention Services. And the other one is Use of Computable Guidelines and Clinical Decision Support to Improve Adherence for Cervical Cancer Screening and Management Guidelines. The remaining 2 activities that we added to the inventory are in the behavioral health subcategory. One is entitled Behavioral Mental Health and Substance Use Screening and Referral for Pregnant and Postpartum Women. And the other is Behavioral Mental Health and Substance Abuse Screening and Referral for Older Adults. We did update one of the improvement activities. It's PSPA 16. It's entitled Use Decision Support and Standardized Treatment Protocols to Manage Workflow in the Team to Meet Patient Needs. We revised the activity to promote the use of clinical decision support, particularly open source, freely available interoperable CDS. We removed 3 previously adopted activities. One is entitled Implementation of Co-Location PCP and MH Services, or mental health services. We noted that this activity overlaps with another activity entitled Implementation of Integrated Patient-Centered Behavioral Health Model, which better aligns with evidence supporting improved patient outcomes. We removed the activity entitled Obtain or Renew an Approved Waiver for Provision of Buprenorphine as medication-assisted treatment for opioid use disorder. In late December 2022, the end of the X waiver was announced, so clinicians no longer need to complete training and obtain a waiver from the DEA to be able to prescribe. So please note that this activity has also been suspended from the program for 2023 and may not be completed or attested to as it is no longer available. The last activity that we removed is entitled Consulting Appropriate Use Criteria Using Clinical Decision Support when Ordering Advanced Diagnostic Imaging. We're proposing to remove this activity as this program has ended, so this activity is obsolete and no longer available for completion. Next slide, please. In developing, proposing, and finalizing improvement activities to be included in the inventory, we consider the following 8 criteria. New activities must not duplicate other improvement activities in the inventory. New activities must drive improvements that go beyond standard clinical practice. Relevance to an existing improvement activity subcategory or a proposed new subcategory. Importance of an activity toward achieving improved beneficiary health outcomes. Feasible to implement, recognizing importance and minimizing burden, including, to the extent possible, for all small practices in rural areas or in areas designated as geographic health professional shortage areas by the Health Resources and Services Administration, or HRSA. Evidence supports that an activity has a high probability of contributing to improved beneficiary health outcomes. It can be linked to existing and related MIPS quality, performance, and promoting interoperability, and cost measures as applicable and feasible. And CMS can validate the activity. Next slide, please. CMS may also consider the following 6 optional factors when reviewing activities to include in the inventory. Alignment with patient-centered medical homes, support for the patient's family or personal caregiver, respond to a public health emergency as determined by the Secretary, addresses improvements in practice to reduce healthcare disparities, focus on meaningful actions from the person and family's point of view, and representative of activities that multiple individual MIPS eligible clinicians or groups could perform, for example, primary care, specialty care. Next slide, please. Next, we're going to talk about participation and how to participate in the improvement activities performance category. Clinicians must implement and attest approximately 2 to 4 improvement activities for a maximum score of 40 points. So note, if you're reporting measures for the quality performance category as an APM entity, you'll also attest to improvement activities at the APM entity level. For most MIPS eligible clinicians, groups, virtual groups, and APM entities, each medium weighted activity is worth 10 points. Each high weighted activity is worth 20 points. Next slide, please. In traditional MIPS, if you have a special status designation, so for instance, individuals with certain special statuses such as small practice, non-patient facing, rural, or being in a health professional shortage area, these improvement activities are weighted higher. The medium weighted activities will be worth 20 points, and the high weighted activity is worth 40 points. Next slide, please. If you don't attest to implementing any activities, you'll receive 0 points for the performance category. Most MIPS eligible clinicians, groups, virtual groups, and APM entities can use one of the following combinations to achieve the maximum of 40 points. You'll either report 4 medium weighted activities, you can report 2 medium weighted activities and 1 high weighted activity, or you can report 2 high weighted activities. Next slide, please. Those participating in traditional MIPS who have a special status, again, such as being in a small practice, non-patient facing, rural, or health professional shortage area, one of the following combinations may be used to achieve the maximum 40 points. You can either report 2 medium weighted activities or 1 high weighted activity. Next slide, please. All MVP participants or clinicians who register to report an MVP at the individual, group, subgroup, or APM entity level receive the following number of points per improvement activities. Each medium weighted activity would be weighted at 20 points. Each high weighted activity is worth 40 points. Next slide, please. MVP participants can use one of the following combinations to achieve the maximum 40 points. They can report 2 medium weighted activities, or they can report 1 high weighted activity. Next slide, please. Whether reporting traditional MIPS or an MVP, MIPS eligible clinicians in a practice certified or recognized as a patient-centered medical home, or PCMH, will receive 100% or full credit for the improvement activities performance category. For organizations with multiple practice sites, at least 50% of these locations must be recognized or certified patient-centered medical homes or comparable specialty practices to attest to this. Next slide, please. To be eligible for a patient-centered medical home designation, the practice needs to meet one of the following for a continuous 90-day period during the performance year. And the performance period selected needs to begin no later than October 4th, 2024. You'll either need to have received accreditation from an accreditation organization that is nationally recognized, be participating in a Medicaid medical home or medical home model, be a comparable specialty practice that has received recognition through a specialty recognition program offered through a nationally recognized accreditation organization, or have received accreditation from another certifying body that have certified a large number of medical organizations and meet national guidelines as determined by the Secretary. Next slide, please. MIPS eligible clinicians participating in an alternative payment model, or APM, will automatically receive 20 points out of the possible 40 under traditional MIPS and MVPs. MIPS APM participants will receive full credit, or 40 points, if reporting via the APM Performance Pathway, or APP. Next slide, please. Next, we're going to talk about reporting and scoring for improvement activities. Next slide, please. To report an improvement activity, MIPS eligible clinicians, groups, virtual groups, and APM entities simply attest to having completed the activity. During the 2024 submission period, that will run from January 2nd, 2025 through April 1st, 2025. You don't need to submit supporting documentation when attesting to the completion of an improvement activity, but you do need to maintain documentation for 6 years subsequent to the submission. Document guidance for each activity can be found on the 2024 MIPS Data Validation Criteria zip file. Examples of the kind of documentation that you should keep: screenshots or digital captures of relevant information that support the attestation, improvement plans and or outlines supporting the interventional strategies or processes that were implemented, or an EHR report that shows the chosen improvement activity as evidence of that attestation. Next slide, please. Attestation can be submitted through one of the following submission types. If you're a clinician, practice representative, or APM entity representative, you can simply sign in and manually attest on qpp.cms.gov. If you are a clinician, practice representative, or APM entity representative, or if you're a third-party intermediary, you can sign in and upload a QPP JSON file with activity attestations on qpp.cms.gov. If you are a third-party intermediary, you also have the option of directly submitting via computer-to-computer interaction using CMS's QPP Submission Application Programming Interface, or API. Next slide, please. The Improvement Activities Performance category, again, is 15% of your total MIPS final score in 2024. And the Improvement Activities Performance category score is calculated by dividing the total number of points scored for all completed activities, divide this by the total maximum number of points, which is 40, and multiplying by 100. The overall Improvement Activities Performance category score is added to the other performance category scores to determine a MIPS final score. Next slide, please. Next, we're going to share some links to resources that will provide help and support as you report to MIPS. Next slide, please. On the qpp.gov website, you'll be able to get to all of these resources. You also have the ability, as you see at the bottom of the screen, to enter your email address and sign up for the QPP listserv, which will give you automatic emails when things are updated. Next slide, please. If you have specific questions or need help attesting to improvement activities or any of the performance categories for MIPS, you can contact the Quality Payment Program Service Center at qpp@cms.hhs.gov, or you can call 1-866-288-8292. Next slide. And that concludes this presentation. Thank you.